The meeting has not formally started yet. So. Good thing we do. Hey, Rob. Oh, no problem. We got work waiting on Joe. So you're not.
Well, then I'm not the last.
Here, Dr. Habor will not be here today. So I think we have everybody that's going to attend, and Joe will be here shortly. So I'd like to call the meeting to order. This is a special agenda meeting for the interview of Mr. Michael Chambers for the position of the Flathead County Health Officer. And it's very limited in scope. And so we will begin the meeting. The date is April 19, 2022. It's 11 a.m. Tammy has prepared a set of questions for Mr. Chambers, for us, ask Mr. Chambers if I need anything else. And I thought one way we could do this is we could just go around the table chronologically and ask Mr. Chambers and see what his response is. But first item on the agenda is public comment. With that, there are three people in the attendance in this room. Do you know how many, Janelle, are on Zoom?
The ones that were on Zoom, they didn't sign up to speak.
Okay.
So,
All right. So is there anybody in the audience that would like to address the board before this meeting starts? Please state your name and address, and you get 3 minutes.
That's it. 'Cause I get kind of nervous when my name is Nicholas Timothy Smith, and I've been a resident of Kalispell for 3 years. And I brought my hat because I was growing my hair out, so it sticks up when so sorry about that if it's inappropriate. I'm a veteran, and I earned the Good Conduct Medal. I also got my Global War and Terrorism Expeditionary Service Medal. I got that for participating in the destruction of enemies of the Republic. I was honorably discharged, and I recently went into gunfire on the corner of Idaho and Main Street to help protect a little infant. This is backed up by 911 reporting, and the recording can be found at github.com/RIPLEY777. That's github.com/Ripley777. You might be wondering why I come to a meeting about the director of the health department. I came because I've been told that this chamber and board runs the health department, which is supposed to be a positive contribution to our community. And the main thing I wanted to ensure was that somewhere in the questioning, there would be questions related to mental health and behavioral health. And we actually have a crisis because a lot of us go home to our nice houses and we say, yes, we have there are resources for them. But the real case out on the streets, it goes 24/7 and it's nonstop. So the purpose of that is basically that a community will erode if you don't take care of the mentally unwell. And Forstall said that the communists would never stop trying to destroy representational government. This continues into our present time. And if you want to erode a society or a community, It's similar to the broken window theory where if you do not treat the mentally unwell, it has to be a tandem approach with law enforcement, which does an amazing job. And then there has to be real resources for people that actually are willing to take that first step and get help for pain medication management. So the purpose was that if this is a committee based on making the community a better place, we have to address this problem before a crisis happens. You can't go back later and rush legislation after something's happened. And to back up what I say, I have recently met two individuals. The first one, I met him in court, and he had anxiety, depression disorder, and manic tendencies. And I drove him around. I found a local pastor at it was the Bethlehem Church. He paid for his urgent care. The only urgent care that would see, or the only place that would see him, if we didn't want to go to the emergency room, was the Med North by the Lowe's. They are very good. They actually want to help people. We took him there to get a prescription of Klonopin, which is for managing, it's for highs and lows, that sort of thing, but it's severe cases. Then I proceeded to look for a primary care physician for him, of which we were going to figure out a way to pay for it. And I drove around town for 5 hours. I did not find a single place that was willing to take him as a new patient or do prescription management, which is the habitual prescription of non-narcotic drugs. And it was very saddening. And I'll wrap it up here, I apologize. There has to be someone for the ones that are willing to get help to go there. They have to be able to have access to a psychiatrist. If you want to erode a community, you cut off access to mental health support, and then soon you have a problem with crazies on your streets, and then everyone's annoyed, and then legislation gets rushed and all that. The main issue is psychiatrists. I personally went to Logan Health. I have anxiety, depression, and I went there. I was very dehydrated. And my experience from being there, I'd gone in, my dad took me. I asked for a glass of water. They refused to give me any. I had to get a soda from the soda machine. They processed me. I had no threats of self-harm or harm to any others. I was taken to a room that looked like a lethal injection room and sat in there, and they took away my belt. And mind you, I just had slow thinking because I was dehydrated. They stuck me in there, and then they released me with a piece of paper that had about 4 psychiatrists on it. 2 of them didn't even answer. The other 2 weren't accepting new patients. So all across the board, you can find where just there is no access. And going along with what's been in the paper about Warm Springs, 2 of the people that I met had been abused and mistreated at various facilities around this area. The specific abuse was, he was told by one that if you wanted to commit suicide, you'd be dead already. So basically doubting a threat for suicide prevention. The other one was that you have to learn how to lie in order to get what you want. The people that work at this facility were advising him to lie because he did not want to take opiate drugs. And they basically said, that's the only thing we could do for you. So that's the whole purpose, is that before there's some sort of local crisis, a new program, something, this is a very serious thing. And if nothing's done, you will have a problem, and this won't be the last best place anymore. You know, we must, there's nothing more evil than a school shooter. It's everyone's nightmare. And we can take steps to prevent things like that by working with law enforcement and offering true mental health, real solutions from professionals.
Mr. Smith, I've got to ask you to wind it up. You've gone about twice over your allotted time frame, so we're interested. Appreciate your comments. You've expressed a real concern. So,
Thank you.
Thank you. All right, the focus of this meeting is to have an interview with Mr. Mike Chambers. Welcome, Mr. Chambers.
It's just, so you don't have to crane your neck.
And just for the record, Janelle did advise us that nobody that's on the Zoom wanted to participate in public comment. So the public comment of the meeting is closed. We'll now move on to the interview portion of this meeting. So welcome. It's pretty much the Flathead County Board of Health, almost said Board of Adjustment. So, you don't know what I want to call that, but, so we have a series of questions for us that maybe I thought perhaps you could just give us a little bit about your background, your interest in this position, and your job history.
My name is Mike Chambers, and I'm actually from the Northeast Missouri. I have been with the small health department in Macon County for the past 7 years. There are some significant differences in the county health department that I run and Flathead County Health Department, which I'm sure you'll find out when we interview. I've been in public health for 7 years. Before that, I was in healthcare, a small critical access hospital for 12 years in a management position for environmental services and maintenance, and then North Kansas City Hospital for 3 years before that. And I always loved healthcare. It was exciting to me. I mean, it was always cutting edge, and we were always doing good things for people. And then I got involved in public health, which I thought would be pretty much a slam dunk coming from healthcare. Took me about a week to realize I was absolutely wrong. Public health is nothing like healthcare. Public health is a whole different animal entirely. But I came to have a very good passion for public health. The people I worked with, people in the community, the way they responded. Public health does a lot of good things. It's just most times very not well known in the community, the work that we do. I enjoy public health a lot. And I want to continue my career in public health. Now, in applying for this position, that's a lifestyle change. My wife and I, my youngest child is now in college, has been for 2 years. We've lived in Macon for about 20 some odd years now. And our children express no desire to move back to Macon. It's a very small town. They have bigger and better things they want to do with their lives. My wife and I were looking for our next step, our next phase in life. And that's when I got the information from Proppman, from Steve, about this position, and I applied for it. The one thing that appeals to my wife and I is that we enjoy traveling, we enjoy exploring different parts of the country that we've never seen before. And this is one part of the country we've never seen before. That's what led me to this part so far. My wife and I are looking for something that we would like to consider for our next phase in life.
Thank you. With that, we just started our interview. We thought Tammy has prepared a list of questions for us. And just to add a little variety, thought we'd just go around the table. Don, we can start with you.
Okay. So what did you think of the tour that you did this morning? Anything that you weren't expecting? Or?
I didn't quite know what to expect. In reading the material in the initial interview, I found out there are a lot of things that are not a lot, but there are certain things that are different from what I'm used to dealing with. You're going to find there are certain areas that I don't have experience in. And to that end, I just want to let you know that people that I've met this morning so far seem very confident. They seem like they enjoy what they're doing, they do it well. And what I've found is those areas that I don't have experience in, I like to rely on the people that are actually doing the work to teach me what their job is and what they need for me to support them. There were things, I know that with mosquito control and with different areas like that, I don't have experience in that, but I do know what it's about. And again, like I say, I'm a good learner. I like to listen to people, especially when they're challenged in their positions and work with them to come to the right resolution. So I don't know if that answered your question or not, but if there were certain areas that I did not know about before I came.
Great, thank you.
This next question is two parts. The first one is, what are your short and long-term goals? And then the second part is, what is the most important element for you in a position?
My short-term goal, like I said, my wife and I would like to have just a change in our lifestyle. My long-term goal is, by the grace of God, I would like to retire at a certain age and be able to enjoy my life. As far as position goes, was that the second question?
What is the most important element for you in a position?
I have to enjoy what I'm doing. I have to believe in what I'm doing. And I already have that. I enjoy the job that I have in Macon County. If this does not work out, I'm not going to be lost. I mean, I'm not going to be out anything because I love the position I'm in. But a lot of that is the people I work with as well as what I do. And from what I've seen here, there's the same kind of passion in people who work here. And so it doesn't seem like it's that big of a change.
My question is, do you have experience working with interlocal agreements or multi-party contracts? And I think, for instance, the county has interlocal agreements with the city of Kalispell, city of Whitefish, things like that. I don't know if that occurred in Macon also, but
We have developed agreements. There are some that are on paper. There are agreements with different areas, different agencies in the U.S. that we do. A lot of what we do are not so formal agreements, like putting together coalitions to better different things like nutrition for children, nutrition exercise for children. We're working on that right now. So I do have some experience in that with contract agreements, obviously with the different government agencies to do like WIC and MCH. I'm familiar with those as well.
Thank you. Mr. Chambers, could you describe for us a time when you had to get support from a wide range of stakeholders on a proposed strategy or plan? And how did you go about this?
Brings back bad memories. During COVID, we have a small county, but in our small county, we have 6 public schools and 2 private school systems. So when COVID hit, we were dealing with 8 different school systems. And obviously with the restrictions that were being brought down to schools, that prompted, I mean, it basically erupted into chaos. So the trick was to get all the schools on the same level road. I mean, we wanted to be consistent with what we were doing from school system to school system. So what we did was invited all the different school boards and anybody else who wished to join us to get together under one roof and meet and talk about strategies moving forward. This was early on in COVID. Strategies moving forward so that way they could successfully teach their children. And we got probably at least 100 people involved in that. And spent several hours talking about what COVID was, what COVID meant, and the impact that would have within their school systems. It was a good meeting at the very end. We did come to agreements and we did put together an action plan, but the process to get there was sort of ugly. At that point, there were a lot of angry people with the way we were working with contact tracing and isolation and quarantine. But we did work through that, and we had better relationships after that with all the schools moving forward.
Hi.
Hi.
Good afternoon. Successfully navigating politics can be difficult. Subtle issues or potential obstacles can easily be missed. Can you describe to us a time when this has happened to you? What political factors caused you problems and how did you deal with it?
Well, I know right now we are going through changes in how public health can perform in the state of Missouri. And that's because our legislature, with their reaction to the last 2 years, they decided to put constraints on public health. So working through those basically took a lot of time, it's taking a lot of time. We have a strong group of administrators, health department administrators in Northeast Missouri. There are 16 of us, and we meet at least every month and talk more often. When it comes to the political aspect of how public health is run or is able to run, we're very vested in being consistent with what we do from agency to agency, because that's one of the biggest hits we took during COVID, was that no public health agency in Missouri was doing the same thing as the other one. We have 114 public health agencies in the state of Missouri, but we're all governed independently. But we all had to act consistently. So to answer your question, I mean, we're still going through this process. We are working together as a group to bring consistency to the changes in the political environment when it comes to public health. And then we are also working with the state government, our liaisons, to make sure that we are consistent and that we are following the spirit of what they want us to do. It's a process, though. It's not something that's going to happen overnight. It's going to be something that takes time. And anything political, that's what I've found. It's not something that you can just do and make a decision and move on. If you have to work through it. I'm not used to talking.
Okay, it's a scenario. You're in a public meeting and you're asked a question that you should probably know the answer off the top of your head, but you don't. How are you going to respond?
If I did not remember the answer, I would ask if I could get back to them. I'm very simple, but I would take the information. I have done that before too, and then respond. Especially if I cannot remember the answer what time the meeting was over.
With your understanding of the mission, vision, and values of public health, what do you think will be the future challenges of public health at Fayette County and potentially the nation?
I think it's bringing public health back into a good light in the community. Public health agencies that I've seen and just listened to in different states, we took a hit in the last 2 years. We were the bad guys for the most part. And so it's bringing back the true values. It's helping the community to understand what the true value of public health really is and how it impacts their lives. I'm not quite sure that was done very well before the pandemic, but I think it's not necessary right now. So it's getting out in the community, it's outreach, it's marketing, it's a variety of things to bring public health back to where it should be. And I think it's also important too, because public health relies on being able to impact the community. If the community does not want you to impact them, that's
Thank you.
All right, back to you, Don. Okay. Would you like to take a break before you get some water, or should we just continue? I understand.
He's coming.
I think they're probably looking for a river or something like that. You know, the river water is good around.
We didn't have any bottled water in there.
Would you care to wait a minute?
no, I'm fine.
You're good?
One way,
Okay.
Yes.
Okay. What are your thoughts on mandated employee vaccination requirements in a long-term facility?
I've always believed that vaccines are choice. and that hasn't changed with COVID. Now, that being said, we talked about a long-term care facility. I know that it's my experience that the residents of the long-term care facility are very pro-vaccine. They're the older generation that lived through polio. They're the ones who know that vaccines save lives. Then when you get to the younger generation, the ones who are actually taking care of and working in long-term care facilities, that's a different story. We encourage vaccines, we educate to let them know how that improves their lives as well as those that they work with. In a long-term care facility, I still think it should be a choice, but I also think that those who choose not to be vaccinated, that they need to take the extra steps to make sure that they're healthy when they take care of others.
So you're kind of saying that you really wouldn't push on a mandate, but you would have another way for those folks to continue.
We have, yes. And that would be, you would have to obviously wear a mask, take the protections, if you're saying, I mean, the same things that we've been pushing in public health for the last 2 years. And then testing is still a very important aspect of COVID moving forward.
Just for your information, mandate, just the word mandate around here during COVID was a dirty word. They kept bouncing it, throwing it back at us and everything else. And I was just wondering how you felt about that.
That's interesting. We still, in a small county, we're still giving a lot of COVID shots now that we're doing boosters. But our nurses are very good. We want to make sure that when a person comes in to get any vaccine, not just COVID, but they understand about the vaccine, about side effects and different things that could happen. Our nurses actually probably go overboard to try to talk people out of getting vaccinated. Most people do not, but we work to educate. And I think that's where, even with COVID, it comes to education, and continuing education, especially about the safety of the vaccine as well as the benefits.
Thank you.
Can you please describe the perfect supervisor?
Perfect supervisor
Yes.
is a person who is there to make sure that I am successful. To me, any leadership position is basically making sure that those around you are successful. They have the tools that they need to be able to do what they do. And then be there to listen. It's about the people working for you rather than about what you're doing. That's the supervision. Thank
What you're telling. So, this position is a very visible leadership role. How would you establish yourself in this role with employees, stakeholders, and community members?
Well, with employees, it would be meeting with them, especially to find out what their jobs are, what they're doing, and what their challenges are. And understanding the programs that they're working with. When it comes to people, it's at over the 3 groups that you mentioned.
They are the employees, stakeholders, and community members.
Stakeholders would be just letting them know that I'm available. Not quite sure how your stakeholders work if you're working directly with people or the people that you're impacting. But to introduce myself and let them know that I'm there for them from the public health aspect. And the community, it would just be when I have the opportunity to get out and talk, I would do that.
And so in one of your earlier questions, you did, this kind of goes on what you were saying now. You talked about marketing and outreach, and that I guess falls into this community outreach type thing. How do you have a certain methodology that you do that?
We did, we still do in the American. We actually, Macon is spread out. There's like 6 major communities in Macon, small communities, but they're still very viable. And most of them had no idea who we were. I mean, they knew the county had a health department, but they had no idea who we were or what we did. So we actually started doing outreach clinics in each of those communities. And this was about 5 years ago. We worked with the local governments there. We worked with faith-based organizations who allowed us to come in and just open up and provide education. We took vaccines if we went to. We also did a childhood vaccination clinic. We did that one time. But then we do pretty good flu clinics every year. So opening up those towns like that, we were able to then do drive-through flu clinics every year, which was also part of our emergency preparedness activities as well. Establishing those relationships actually helped us during COVID because we knew who the players were, we knew the government officials, and we also knew who we were. So it was a very easy transition when COVID came that we were able to continue working.
This should
We
be,
do a lot of marketing, I'm sorry, we do a lot of marketing too, especially through the grant funding that we're getting from COVID right now. We are doing a lot of advertising, we're doing a lot of press releases so that, in that respect, we're doing as much as we can through different channels.
no, all right. This will be an easy one. What is your greatest accomplishment so far in your career?
Well, I have to say, throughout my entire career, I've always looked at my next step to move up. This isn't a move up, this is sort of a level move. But I'm very proud of the way that strategically worked through different companies, and I don't mean that in a negative light. I've been companies I've worked for, I've always worked for a long time. I try to learn as much as I can. And apply that to them.
This does have a follow-up question. You probably anticipated that. What has been your biggest failure?
Biggest failure.
In your career? I'll add that. We'll keep this business professional, yes.
Boy, that's a tough one because, I mean, I've had failures, but I've always used them as opportunities to grow. Biggest failure. Good one. Biggest failure. Can I come back to that?
Yes, you can.
You're putting that on the parking lot, huh? This position tends to be very public and stressful, more stressful than that last question. And this position has certain obligations in a crisis. How would you describe your ability to manage under these stressful and crisis conditions?
I would say they're very good. My ability to do that's very good. I've done that for the last 2 years. But taking a lot of criticism, a lot of threats. I know that friends who used to be friends, not friends, just because of everything that happened with COVID. You know, we did the right thing. With the information that we had at the time and the information we continue to get, we do the right thing with what's available to us. People don't like what I do, I mean, I'm okay with that. They don't have to agree with me. But as long as I know that what I'm doing is true and correct, then I'm completely important.
Okay. Have you had to evaluate a program's efficiency? And how would you undertake such a endeavor?
Did, right after I first started at the Macon County Health Department, I took a look at our WIC program because it seemed to be bogged down in a lot of bottlenecks. So basically, we got together as a group with the staff and worked through what the actual process was, and we did find 2 or 3 different bottlenecks within that. So what we did was we threw around ideas of how we could maintain the outcomes that we wanted under their guidelines, but process, and I hate to say this, but process people through quicker because no one wants to wait, 45 minutes to an hour in this program. So we were able to make changes to our processes that reduced the bottlenecks, or actually got rid of them to make it a more efficient process. And in doing that, I don't know if this was coincidental or not, but very shortly after that, our numbers started going up and we started seeing more clients. who actually liked the process was better. Survey them before and afterwards to make sure that we could do the right thing.
Thank you.
Okay, what is the most difficult issue you've had to deal with regarding this subordinate employee, and what did you do and what was the outcome?
I think it's failure. Two birds with one stone. Sure. Every company I've ever worked for, always had a human resources department. I always relied, I didn't realize it, but I always relied very heavily on those departments. And now I truly appreciate them for who they are. Shortly after I started, and I can't get into a lot of detail with this, but I had an employee who needed to take time off, part-time employee who did not qualify for it. And because I was weak in human resources and probably didn't pay attention as closely as I should have, through misunderstandings on both of our sides, and I don't know if this is in the packet of information you have, but charges were filed against me with the Human Rights Commission, Missouri Human Rights Commission, and the EEOC for age discrimination. That's my biggest failure, realizing that I was weak in an area where I should have been stronger, and that's human resources. That ended all right. I mean, I think it didn't end as well for either one of us like we would have liked to have had it. But no charges were brought to me. To let you know that Missouri Human Rights Commission actually picked it out because it didn't meet their standards for discrimination, and EEOC did an investigation found no longer. But unfortunately, we ended up having ways with the employee, their career choice. I don't know if I answered your question, but that was my biggest failure. And what I learned from that was I needed to learn quite a bit more about human resources, and that's exactly what I did. After 2 years, I learned everything I could and became a better human resource director, at least with that hat on in my thank you.
All right. This is a scenario question. You suspect an employee is abusing sick time. For the fourth time in the past 2 months, this person called in sick because they had a headache. Co-workers are getting upset handling the extra work. How are you going to deal with this situation?
Well, I'm sure that there's a formal process and policy to deal with that. I would talk with the employee to find out if there was something more going on, and if there were any work-related issues that maybe, or even personal issues that were preventing them. I try to work with the employee to change the behavior first. And if the absences became excessive, then work through the discipline process. If you let it go too long, you take a chance of losing good people. But first, try to work with the employee to change the behavior. And that doesn't happen with the discipline process.
And then you let HR handle
Yeah.
it. Thank you.
This is also a scenario question. An employee comes to your office and says, I want to tell you something, but I need you to promise me that you will keep it confidential. You can't tell anyone. How do you respond?
I would probably, not knowing what was going on, I don't know if I can make that promise. I wouldn't make a commitment one way or the other until I knew what they're doing. If they chose not to talk to me, then I would really recommend if they wanted to go over me with my board, I'm sure they would have to do that.
Well, this one, you might want to get a drink of water before you answer this one. Often it is easy to blur the distinction between confidential information and public knowledge. Can you give an example of when you were faced with this dilemma and how you handled it?
Well, going back to COVID again, because that's where a lot of the lines are to begin with. We live in a small community, so everybody knows what's going on. The first case that we had of COVID was very public, not by us. She put it out on Facebook. It became a nightmare after that. We had so many sightings of her in the community, and she should have been in isolation. And we had a very good relationship with our law enforcement agency, so we have to take care of that. But the people who come to us trying to get information about the person, and honestly, we never even identified that person. I mean, through the 3 months that we kept getting complaints about her, even though her COVID was over, her isolation was over, we never identified her as someone who had COVID. We stuck very closely with that. But I think in answering the spirit of what you're asking, when you're on a phone conversation with somebody who's hot and complaining and yelling, it really is hard not to want to say something and keep it confidential. I think the best thing to do is just sit back and listen and remember that there's more going on than just that conversation. There's people that do need to have protection. Confidentiality, I think, is a very, it's a very clear concept, but sometimes it's hard not to explain what you're doing or why you're doing it without breaking confidentiality. I'm not going to answer your question, but I mean, I've come across so many different instances where it was very easy to try to use the information.
Okay, thank
I
you.
worry about that.
Okay, adapting to a different organizational culture is sometimes difficult. It should be, is always difficult. Describe a time when you had to assimilate into a new organizational structure, and how did you accomplish it?
The job that I currently hold, I had to do that. The administrator before me, from what I understand, is very hands-on micromanager. Very little could be done without her knowing about it or directing. So when I came into that position, and I love this lady too, I mean, I've known her for a long time, but never worked for her. When I came into the position, everyone was afraid to do anything. I mean, because they didn't have me directing them, and I'm not that kind of a manager. I don't look over people's shoulders. Most people know what to do, and they do it very well. I'm just there to help them out. And what I did was I just talked to people, let them know that I was there to support them, and try to earn their trust. And it took a little bit of time, but after people realized that I wasn't there to ride them and watch over them, and we started doing some pretty tremendous things because we enabled people to do their jobs. I told you that some people can just take it aside of it. That's what they want.
I get to ask a really fun question. Do you have any questions for us?
The questions I had were answered to me. I found it interesting. I have an elected board of trustees, and I work with county commissioners. Now you're a commissioner, is that correct, sir?
No.
No,
Yeah,
you're a
Cam is
commissioner.
You're the commissioner. Don't go there.
All right.
Come on, Roy.
And our county commissioners, we work with them closely. But I don't answer to them. I answer to our elected board of trustees. And so I found it interesting that appointment. How does that process work with, I mean, look, I know it's not about for you. So, how does that process work for you with public health?
So our board here is pretty much an appointed board. We're not elected. For instance, Rod's position is a representative of the city of Kalispell. Jessica's the city of Columbia Falls. Whitefish City, yeah, sorry, Don. Good catch. So anyway, and then the rest of us, for the most part, are appointed by the county commissioners. So, but I don't think that we serve at the behest of the county commissioners, but we serve independently of them. We're not just gonna first of all, they don't give us guidance or direction. You know, we make our decisions independently of whatever their purview is. And so we may not even agree with them at times, or probably haven't at times. So, you know, but the ultimate, if there is some decisions, the ultimate decisions come from the county. Pam, you could
Yeah, no,
clarify
that's
that even
correct.
more.
Before COVID, the board would actually hire the director. But through COVID, the legislature changed that to the county commissioners now hire the director. The board makes a recommendation. That's the only change that's happened in the last 2 years. But the board itself, as Roger said, is pretty independent from us as commissioners. We appoint what we feel are qualified people. They do the discussions, they do a lot of the day-to-day administrative, all that stuff, all that administrative review decisions. But if there's, I'm trying to think, mostly just the hiring of the health officers, really, where we come in. Any land purchases, any capital improvement things like that, comes to the commissioners for approval, blessing. The budget comes to us. But other than that, you guys, the health board's pretty independent from us, which is I think a good thing.
So for instance, we meet routinely on a monthly basis. And usually I work with the director, we develop an agenda for that meeting, or the chairman does, whoever it happens to be. And oftentimes there'll be action items that range from everything from approving grant applications to variances for a septic system or something. So some of them, as part of the meeting, is just routine reports from the different department heads to stay abreast or currently, you know, the animal shelter is a big thing. We always have a good report from them and the various other departments. My background is environmental, so I'm more involved with that aspect of it, the environmental health section of the whole health department. So it's, you know, pretty independent and it's pretty informal for the most part also. So I guess if any other board members would like to comment on our role, and, you know, feel free.
I'm new.
Yeah. But Jessica has been with us now for 2 years. She represents the city of Whitefish, and she has a good perspective because she's a veterinarian, so it's great for the animal health or the animal shelter portion of it. So we really, you know, we're pretty diverse board in our background so that we can handle a wide variety. We're missing one medical position right now that we're planning to reinstate with a medical person. So it's a good board, I think. So I guess I thought that Tammy did a great job of putting these questions together. And some of them were way beyond what I would have asked, so good job. But I had, you know, if you don't mind, maybe we could ask some informal questions. That's all right. So I guess I saw in your resume or something where you had some environmental background. I was wondering if you could elaborate a little more on what that involvement was.
Environmental services, not environmental in public health aspect. It is housekeeping and infection control at the hospital. That's what my background was. I worked for North Kansas State Hospital for about 3 years. That's where I got into environmental services. And it was very much infection control. I mean, housekeeping is an aspect of infection control, but reporting on it is much more than that. With other department heads to make sure that, you know, hospital infections are very, you don't want that to happen, you minimize those. So that's part of what I do. A little bit different environmental. than-
Yeah, they're different connotations.
My foray into the public health environmental, and I'm still learning a lot about that. Very good environmentalist who teaches me a lot of what he says goes over my head, because he's ex-military and he is very regimented talk sometimes in circles. But together, he and I do, he does a wonderful job. So I just been there to support him and help him with that thought as well.
Great, yeah. Well, we have a great environmental health department here too, that deals with that. And, yeah, and there's some senior people that are well qualified and bringing up the entry level people. So it's a profession, but it's a pretty solid program. So anyway, I guess any other board members?
Yeah, I have a question for you, Mike. You said you have what, 3 communities in your main communities in your county
6,
that you administer to? How big are those communities?
ranging from a few hundred people up to Macon is where I live, and that's 5,500 people.
I see.
There's 15,500 people in the county altogether.
How big is your staff that you work with in the health department?
It's 14.
How many?
Includes 14,
Oh.
and includes FTEs as well.
Thanks.
I was wondering if you would care to comment on the public comment that you heard given by the gentleman today. You did bring up some pretty relevant points about the mental health crisis that our valley is, and lack of access to care that our community is dealing with right now.
And you're not alone in that, it's all over the country. In the last 2 years, it's gotten worse, and unfortunately, it's impacted, I think, our youth a lot more than what we realize right now. Because a lot of support systems that kids had, especially the first year of COVID, they didn't have those. So I think we're just now starting to see the effects of that. I think it's important, but the thing is, the mental health probably is one of the areas that lacks the resources needed to actually change it. I do know that, I understand there is a mental health portion of this public health department, right? Good. Yes. Which would be interesting because we don't have ourselves with outside agencies for their folks. I think gentlemen had a very valid point, especially with our veterans as well. I mean, it does need to be addressed, but I'm not sure what the answer to that is. I think as long as it's being actively worked on, I think that is a big part of it. I don't know if everything is being actively worked on, especially like I said, when it comes to schools.
Any other questions for Mike? I guess it's, so your staff is currently 14, this would be quite a quantum leap.
But how many staff do you actually work with? To manage, I know, but to manage.
Oh, I mean, we have division directors, division managers. But, I mean, we have 68 FTEs and probably 7 job openings right now.
I know,
I know where there's stuff.
but managing also the layers too. I mean, the department heads and the department heads more closely. To make sure that they have the thing.
Yeah, delegation is important.
Yes.
So, all right, well, I guess Tammy, do you have anything further? Joe, did you have anything you wanted to add?
No, I just here for that.
He's already got short timers attitude.
Station.
All right, well, we appreciate you coming today,
Thank you.
taking your time to visit with us. Thank you.
Enjoying it, so.
So I guess there will be no decision made today. This was strictly an informational meeting. We will take our notes and deliberate at a later time. With that, if there's any other comment by board members?
A comment I could say is, with your love of community or of the health department, you got to be excited when you see all the cool things that we do here. Don't you think? I mean, if you're excited about this type of work, this is just a great position. I mean, it's been set up. Joe's been instrumental in setting it up and Board of Health, and it looks, to me, I would be excited to do something like that. Is that how you feel, Brian?
It is. It is. And this morning was, I was eye-opened, to meet with the different departments and find out what they were doing. A lot of similarities, but then again, a lot of them are different. So and that's the part that would excite me the most, is learning, the different areas I don't know.
We'll enjoy our valley.
Yeah, well, I guess, and I'm, at our board meetings, I'm always impressed by when each department head comes and talks and gives us a presentation, how knowledgeable they are and what great staff we do have. So Joe's done a great job pulling this together over the years, the previous director also. So I think we have a really first-rate health department. So with that, I guess if there's no further comment, we'll close the meeting. Thank you.
Thank you.
Thank you. Thank you so much.